So I wanted to go over some common drug interactions that I see that I do intervene on in this video. So this is going to be part one of a series, a pretty long series, because it's my favorite sort of thing to do as a pharmacist. Counsel patients and even providers on drug interactions. So today I had a patient who was sent over 2 prescriptions, one for lisinopril 40 milligrams daily and one for losartan 50 milligrams twice a day. Both of these are high doses. Both of these interact with each other. They're almost in the same drug class. Lisinopril is an ACE inhibitor. Losartan is an angiotensin receptor blocker. In combination, they can result in hyperkalemia, which means increased potassium levels, and they can also cause hypotension as well as kidney problems. So the MD was aware of this interaction, and he put that in the notes, and I denied the fill, and I sent a note back to the provider requesting kidney function labs, potassium levels, as well as diagnosis code other than just hypertensive, as well as failed therapies to make sure that the patient has been optimized on other therapies, or at least trialed them, like amlodipine, calcium channel blockers, thiazides like hydrochlorothiazide, any other first-line therapy that this patient has tried and failed before I'm going to consider the patient being on both of those. I've had a patient who's elderly with renal impairment be prescribed a blood thinner, Lovenox. She was given the incorrect dose as well, given a treatment dose instead of prevention, and it also wasn't renally adjusted for this patient, meaning her kidneys aren't working as well, and the dose needed to be lower than what was prescribed anyway. I've had patients prescribed both Eliquis and Xarelto at the same time. These are 2 blood thinners. This combination can result in death. It can result in hemorrhaging, internal bleeding. This is something that needs to be not happening, I guess. You need to send over one or the other. You don't take 2 DOACs, 2 factor 10 inhibitors. That's totally inappropriate. And the provider should have clarified in one of them, like fill only one of these, or at least put clarification for the patient, not just sent over both of them, as both were failed and the patient was going to pick up both of them. So I intervened on that one. I've had patients take Brilinta, Plavix, and aspirin. That's triple antiplatelet therapy. After you get a stent in your heart after a myocardial infarction, a heart attack, you usually get dual coagulant, or not anticoagulant, but dual antiplatelet therapy. This patient was given 3. So Brilinta and clopidogrel are in the same drug class. It's unnecessary to be on both. I've had patient prescribed Primidone. Primidone is a seizure medication. She was also on birth control. The Primidone was metabolizing the birth control, and she's also buying a pregnancy test because her seizure medication resulted in a failed contraceptive efficacy.